Hello, everyone. My name is Jasmine Stanley, and I am here today to talk to you about a community problem. I am a social work student here at Grand Canyon University in social work class 545, generalist social work practice 2, groups, communities, and organizations. Um, with my professor, her name is Ashley Santiago Fernandez. So I hope you all enjoy. So today let's talk about what a social worker is. Okay, so what is a social worker? A social worker is a person who helps vulnerable people with a wide range of issues. So from finding secure housing, funding, community services, and also providing health treatment. Okay, so mental health treatments. Also, social workers advocate for vulnerable, marginalized individuals, families, and communities. And in this case, we're studying macro social work. So, macro social work involves working with communities and organizations to develop and administer programs and policies. Additionally, social workers provide resources, education, and tailor made interventions to accomplish a common goal. Again, in this case, that common goal would be for the community. So, when we look at social work, there are three different aspects. So, we have micro, which focuses on individuals. We have macro, which focuses on the community and organizational changes, and we also have meso, which focuses on a larger scale, okay, and like policy and legislation and things of that nature. So when we look at social work, we have to look at the population that's serviced. Okay, so social workers serve and work in many different capacities. Those capacities could be schools, right? So we have school social workers, and they provide essential supports and services to families, to students, and to school staff. So not only do they come in and just kind of like make sure the child is okay, but they also provide resources for the families, any other organizations, or the school staff. They may need some extra help as well. Additionally, we have medical social workers, and a lot of medical social workers work in hospitals, they work in mental health facilities, things of that nature. So they work and do things like power of attorney information, or they talk about social justices and like the rights that the patient has. Community justice social workers. So those are pretty much legal advocates, okay? So they do a lot of the legal work. We also have environmental social workers, and they more so focus on like the ecological aspect. We have community social workers, and they look at outreach and activism, things of that nature. We also have child and family social workers, and again, that's kind of like self explanatory. So they look at the child's family life, they look at what services they can provide, what resources the families may need. Something like a school social worker, but it's really just focusing and honing in on the family life, the child's family life, the child's home life. Okay. So, community needs, and this is very interesting to me upon my research. So, when I looked at the community needs of social workers, I had to look at the need of the actual communities that we're servicing, right? So, more than 771,000 people are experiencing homelessness nationwide. Okay, 18%, that has been increased from 2023. So there's an 18% increase from 2023. We have 269,000 individuals with mental health issues in Wisconsin alone. So that's a great community need for social workers as well. As I stated, medical social workers focus on mental health. So 262,000 adults in Wisconsin have had a mental health crisis that has went without treatment. So that shows another need for social workers. The community really needs someone to educate and provide resources for them, to help with these mental health crises and mental health needs, right? So almost 75,000 referrals from reporters allegedly discussing the mistreatment of children have went out in Milwaukee County. So 75,000 referrals have went out for people claiming that they know of or that they've heard of a child being mistreated. So that again shows a great need for social workers and just the community need all together. Um, yeah. Okay, so when we look at the community assets, and I think I touched on this a little bit before. So social workers are essential. And during the COVID-19 pandemic, social workers really were essential, okay? So they coordinated family communications, they provided crisis counseling, they connected patients with community resources during periods of isolation. And if you remember during COVID-19, we were stuck in our homes and we had been so used to leaving outside and going, seeing people, going to the gym and, going to work and actually physically being able to touch one another. Well, during that time, we were told, hey, you can't go out. So that kind of bothered a lot of people, and their mental health started to, issues started to spike, and people started to notice, like, listen, I need to communicate with people. I didn't know I had such a need, and that is where social workers came into to play. Right. Social workers also testify before legislative bodies. So they conduct community needs assessments that inform policy decisions and mobilize grassroots campaigns addressing systematic inequalities. So when we look at social workers and we look at the different social injustices that our community faces, right? So we have injustices where some people don't have the same access as others. We have injustices where those resources are available, but no one's giving them out. So as a social worker, our role and we're essential because we are able to provide that and we're able to give resources and also close some of those gaps in care, right? So we also have to, as I stated before, look at the three different areas of social work. So micro social work, it focuses on the individual well-being, right? So it's focusing on individual needs, individual care, individual resources. But when we look at macro social work, it focuses on the community and group changes and challenges. One of the things I love about macro social work is that it helps you to look at the bigger picture. So we don't just focus on the individual, which is important, but we also go back and we look at, okay, let's look at the systems theory. Let's see why this is happening. Let's see what we can change on a different scale, okay? And so then when you look at meso social work, you look at the larger systems, you look at governmental systems, you look at policy change and legislative policies, and just see where we can advocate and lobby against some of those injustices and even maybe change some things to not only make the individual better and not only make the community better, but make the governmental aspect better as well, right? So, when we think about social workers, we have to look at their resilience. We have to look at their strengths, right? So, when we think about social workers, we have to think about how they exhibit empathy. Um, social workers meet people who have trauma every day. They're meeting people who have experienced pain. Some have experienced death. Some have experienced domestic violence. Some has just experienced just racial inequalities, right? Gender inequalities. And so we have to exhibit empathy every time we meet someone. We have to come in non-judgmental. Okay, so then we also have to we have to have active listening. So not only are we listening to hear what the client is saying or their need, we have to listen and be able to give them back what they shared with us. We also, as social workers, another strength is we have clear and concise oral and verbal communication. So we're able to write out what's needed. We're able to articulate what's needed clearly and concisely, because we want to make sure that we don't misconstrue what's needed, or what the client needs, or even what the client is saying. So another strength that social workers have is we have to have great critical thinking skills. So again, we're thinking outside the box. I love that about the macro social work, because you have to think outside of what we visibly see. Additionally, another strength that we all exhibit as social workers is cultural competence, right? So you want to be educated um, as a social worker on the different cultures, the different belief systems, the different traditions, the different understanding of how things are done. And then not only do we want to be culturally competent, but we also want to exhibit cultural sensitivity. I may not do things the way you do them. You may not do things the way I do them. However, I want to be sensitive to your beliefs. I want to be sensitive to your culture. I want to be sensitive to your traditions. I want to be sensitive to how you articulate and how you perceive and how you cognitively understand information. Also, we want to exhibit cultural humility, and all of this is bundled up for me into cultural competence. So we want to have cultural humility. It's okay. Humility, humble yourself, like understand that no, we don't all think alike. That's what the beauty of diversity is. So we have to go in without bias. We have to go in self-aware. Another strength that I wanted to discuss was self-care. And I chose this last because this is labeled as a strength, but it also brings me into my community problem. So one of the things that we are prided on is having self-care and taking the time for ourselves. But all the things that I just listed can sometimes cause what I like to call the community problem, which is social worker burnout. So we look at the policy and legislation, okay? So when we think about self-care, what the NASW, which is the National Association of Social Workers, has recently changed their policies, right? And they've changed them to support the advanced professional as for self-care. So what that means is the integration of professional self-care as a best practice with social work curriculum included, which is included in the field practicum. Okay. Additionally, the NASW supports ongoing opportunities to process and debrief after traumatic or stressful occurrences, and understand that as social workers, we meet people every day who's had traumatic and stressful occurrences. However, and in addition to, we experience the same thing. Additionally, the NASW has now promoted the development of professional self-care plans by social workers, which means they want to prevent and address the adverse impact and to promote resiliency. Okay, so social workers carry a lot, and I'm so grateful that we have policies that encourage self-care. So let's talk about this community problem, okay? Social work burnout. So when we look at social work burnout, I already discussed with you all the roles, I'll say, the role of a social worker. But when we look at burnout, we have to remember that 8 out of 10, which is 82% of social workers suffer from stress at work, with 2/3, which is 65%, saying that their mental health is suffering because of their job. Okay, so 2/3, which is 58% of social workers, say that their caseloads are unmanageable. So that means that their caseloads are simply high. So they have increased caseloads, which can result in burnout for the employees. Additionally, mental health social workers may have higher caseloads due to the high demand for their services. And as I stated before in the prior slide, mental health needs are increasing daily, especially here in Wisconsin. So the social work burnout doesn't just affect the employee, which is the social worker. It also affects, the community, right? So social worker burnout does not just affect the employee. So let's make sure we remember that burnout is associated with 52% with a 52% increase in employee turnover rates. So people are literally leaving their jobs. Okay, communities are affected as well. Customer service is affected. Customer satisfaction tends to decrease by 45% when employees are experiencing burnout. 38% decrease in overall safety. Okay, so this potentially impacts the workplace safety measures and outcomes. So there's a 38% decrease in overall safety just simply because of the burnout that social workers are feeling. Now, there are formal and informal resources, and I really enjoyed looking this one up because I found out that here in Wisconsin, there's a formal resource which is called Recovery Excellence, and it's actually a burnout treatment center. Okay. Additionally, most employers have employee assistance programs, and we like to call them EAP. Okay, but they're employee assistance programs, and sometimes they're complete with therapy and people that can talk to you about different techniques when it comes to self-care and burnout. So that looks like self-care training in our role. Okay, so informal resources is physical exercise, which is a really good thing. You can go out and walk, right? Social workers can come together and maybe just join like a little walking team. Spiritual counseling, so prayer, meditation, reading our Bibles, reading our word, that can also help. Additionally, therapy, right? It can be therapeutic just to journal. And that's something informal. We can go to the store and get a notebook and just kind of journal and write down what we're feeling, how we're feeling, releasing some of that stress just kind of by writing it out to get to see how we're feeling and what's going on for the day. So that was a little bit of formal and informal um, services. So upon gathering information, so I spoke with my field instructor, and then just kind of like gathering just different information from different people. So within family care, case managers, which are many are social workers, are burnt out due to high caseloads, and we've discussed that. I can specifically say that in most family care agencies, the case manager or social worker should only have 40 people on their caseloads, or 40 members or clients, however they call it. But we've seen where people have up to 50. 47, 45, and the workload that you're expected to do, sometimes that can become overwhelming. Many social workers don't feel the support from leadership. That's another part of the information that I gathered. You don't feel the support of leadership. Many social workers don't feel like someone's there to have their back or to just hear them out. Okay. The community needs and access far exceeds the capability of the employee. Sometimes that's due to a lack of funding. Sometimes that's due to the access that, like mental health therapists, right? So sometimes they're overworked as well because there's such a need. Sometimes the services that the client requires, they're not able to get just from authorization or funding or things like that. But a lack of funding and access for these needs can make you overwhelmed and can burn you out as well. So some opportunities for conversations regarding burnout and boundary setting was one of the good pieces of information that I gathered. Additionally, my field instructor quoted, "Sometimes we're just spread too thin." And unfortunately, when you are spread thin, and unfortunately, when you feel like you can't go to your employers, when you feel like you're burnt out, what do? So that's where those formal and informal resources can definitely come into play. They're key for, just getting better, getting the mental health better. So when I frame this problem, so again, we've already discussed social workers experience burnout within their employment agencies due to an overload of cases. Right? This results in mental health issues, high turnover rates, and gaps in care for the clients that are being serviced. So, again, it doesn't just affect the social worker, it's a community issue. Our clients need these services. But if the employer, I'm sorry, if the employee is not 100%, then honestly they can't give work that's 100%. So my working hypothesis for change includes employees prioritizing the social worker's mental health. So us as social workers prioritizing our own mental health, understanding that we are not supermen and superwomen, right? Also, employers encouraging self-care and promoting non-work related solutions, as like we discussed, the formal and the informal resources. So these things can actually, for me, these things can really come into play, and they can be beneficial because everyone wants to feel supported. Everyone wants to feel valued, and everyone wants to feel heard. So when employers prioritize their employees and their social work and their mental health, then I feel like the employee would feel better about him or herself. Okay. And also, as the social worker, ensuring that we're utilizing these formal and informal services. Exercise is great. Journaling is great. Prayer is great. And it's free, right? But I know that there are other things that we can do, which is probably go back to the NASW Code of Ethics and read about prioritizing self-care. The next slide that I am going to provide is just a general slide of a different family care agency, Milwaukee County, which is the geographical location that we service. And I just chose a picture of people because we're all humans. When you look at this picture, somebody could be a social worker, another person could be a client. But at the end of the day, we're all human, and we all deserve the same amount of grace. We all deserve the same amount of care, and we all deserve the same amount of service. So I want to thank you all. I have provided my references into this slideshow, and I appreciate your time. Thank you.